Hi, I'm Jennifer Stagg, and my practice is in Avon, Connecticut. It's called Whole Health Wellness Center. I'm a naturopathic doctor, and in our practice we have a group of providers, integrative providers, and we all focus on science-based natural medicine. My whole approach to treating patients who come to me with a list of different conditions, 5 to 7 conditions is typical of a new patient. Getting to the root cause is really important instead of treating each disease separately. So lifestyle tends to be where you start, and dietary habits are critical. I tend to recommend genetic testing for patients who have type 2 diabetes, they have pre-diabetes, they have metabolic syndrome or insulin resistance. A lot of those people have tried a lot of different diets. What happens is that people know what they should do, but they don't end up doing it. So to be able to identify what the behaviors are that are driving them to basically a state of not having success with their eating habits and addressing those really precisely is why the Pathway test works so well in our practice. You will have patients who come in and they're on a ketogenic diet. I've certainly had enough experience with this. They're either on a paleo diet or they're on a ketogenic diet and it's not working so well, but then we'll do genetic testing on them and they end up matching up to a low-fat diet. So there's no surprises there about why they're not having success with that type of a dietary plan. So there are a number of key areas in the Pathway Fit report that I spend more time going over with patients. The behavioral traits I spend quite a bit of time going over, and I actually have a checklist basically, so I will identify which traits the patient has tested positive for, and then I'll highlight those on a handout and give them basically techniques that are specifically targeting those behavioral traits. And I talk about it as, here's your relationship with food, here's why you're having the trouble that you're having. Another area then certainly is diet, and that's often the reason why most patients choose to do the test. So then we talk about the macronutrient balance, we talk about healthy fats and which ones I describe as being their super fats. And then we do talk about metabolism, talk about the obesity genes. I've even had patients crying in my office when I go over these results because it helps to take some of the guilt and shame away about why they've had the trouble that they've had with eating for so many years. A good example of a case where I had a patient who was it was a current patient I hadn't seen in a while, and she came to me because she was not having success anymore with the paleo diet she had put herself on. You know, she had kind of gotten in a rut, she was eating poorly, had gained some weight, and so she put herself on a paleo diet. And initially had some decent results, so she had actually lost 20 pounds, but then for the last 3 months she was still following the paleo diet but was not having any additional weight loss, and she still had weight to lose. She came into me and I said, well, I think this is a great place where we should use genetic testing. So we did the Pathway Fit test, and she matched up to a low-fat diet. So she switched to the low-fat diet, and within a month, and this was during the holidays, and she also had a sinus infection and had been on antibiotics, she lost 10 pounds of fat basically in a month during the holidays. So I think that really highlights how impressive results patients can get with Pathway Fit testing.